So today we're concentrating on antenatal booking. The prerequisite of this demonstration was to watch the antenatal booking video that Gail would have sent you. So I'm not going to go into detail with the booking at all. So really, it was all about just going through the key points from that demonstration, any questions from the demonstration, and then after that, it will be looking at the configuration, which it will be mainly Gail on that part of that call as well. So I'm going to just quickly give you the key points of the demonstration, and then open up to any questions that you've had from watching the video or any queries, and then we'll go on to configuration. So as I said, I think if we go back to last week, was it last week? Was it last week? It was last week, wasn't it, Gail? Last week where we did the self-referral, and when we referred to your services, she was given access to her app, and before the antenatal booking appointment, she would have done her pre-booking. And then what will also happen is that the record would also be on BadgerNet ready for the midwife for the booking appointment. Okay. So this record you can see in front of me has already been booked. I'm just going to go through a couple of things with that. So for those that have not seen BadgerNet before, I'm not sure if you've been on the last call. I think maybe, I'm not sure if anybody that's not, is anybody on here that's was not here last week? Yeah, okay. So just to kind of give you a rough kind of look at the screen, once you've clicked onto the record, this is what you're presented with. You presented with the top banner, which is we call it the patient banner, forget my mouse. And this will give you some demographics. It will give you the gravity parity. It will give you gestation if she was, this is delivered, but gestation if she was antenatal, EDD if she was antenatal as well. You'll have a number of babies, and you'll have some key kind of clinical information here as well as part of that. On the far right, you'll have some icons, so or alerts, should we say. Those icons indicate different things. When you do your core course, it will tell you all about what icons mean what. But for example, this one has a yellow flag, and that indicates that there are safeguarding or domestic violence issues. The black folder means that the record is closed. So the record closes after 6 weeks after handover to the health visitor. It automatically closes. And then this icon is just basically what we call key details. So no matter where you are in the record, you'll always have access to look at the key details, which is almost like a subset of the pregnancy summary page, which I'm going to talk about now. So the pregnancy summary page then is a summary of all of what's going on at the moment with this pregnancy. So you can see here that she's had 2 babies. One was a stillbirth. You can see what her health history is. You can see her latest risks. So this is from her latest risk assessment. You can see that she's delivered. There's some delivery details in there. It's not a complete record, so you'll see things that's probably not there. And then you can get to blood loss. Another thing to mention is that once you are live, you become part of the single pregnancy record. That means that no matter where Claire goes, so she goes from Bedford to, I don't know, Barnsley, because they also have BadgerNet, they will have to they can pick up this record and write to the same record. So everything that you see, they see, and they can write to that same record, which is the beauty of BadgerNet, and with a lot of the clinical risks around that. So it's really good for that kind of thing. Further down, you can see your scan details, screening details, management plan. So the latest management plan will be also here and shown here as well, depending on where we are. Medication, if you're going to be using it, is also there. We also have social summary, any key events. So if she's been to antenatal clinic, been to fetal medicine, things like that, you'd see that. If she's been admitted, you'd see that. Any referrals would be here as well, and upcoming appointments as well as part of that. The bottom banner is our alerts. So depending on what alerts Gail turns on for your trust, they will, depending if they've been triggered, they will alert down here, and all the alerts can be seen. Just to also say that anywhere on this page is clickable. So if I wanted to go and see about, I don't know, let's see about this antenatal clinic visit, if I click onto it, it will open up the visit details, and you can see that. So it gives you a summary of the information that was inputted, basically. So you can click onto any of them. On the left-hand side, this is where you get all your notes and things depending where you are. So we're looking at antenatal booking. So it will be notes during pregnancy, and once the booking has been done, what normally happens is you get an antenatal booking tab. So on the antenatal booking tab, when the booking's completed, I'll just go through what's done in the booking. So this is the booking note that the community midwives will be using to do their booking. I'm just going to go through a few key bits from this, and then I'll open it for questions because, as I said, everything's in that video. So first thing I want to note is that names and teams and things. So in the configuration, every community midwife will be allocated to a team like you have now. So when the midwife logs on and she says that she's the midwife doing the booking, the team, obviously I'm not part of a team, the team would automatically populate for you because Gail would have configured each midwife to a team. So it was kind of saves time. We like to save time for the midwife as well. And then also, if I come down to here, when we talked about last week about the woman doing her booking before, part of the booking is to click onto this import pre-booking, and this basically gives you all of the things that the woman would have completed in her app before the booking. So the midwife will be able to review all this, make sure the midwife is happy with all the things that's been entered. Once she is happy, at the end of it, it's already been done, but at the end of it will say import. You click onto it, and what that will do, it will input all that information throughout the booking. So when the midwife goes through down the tabs and gets through to certain areas, you'll see that certain things have been already pre-populated, and that's from the pre-booking that the midwife has. I'm not the midwife, the woman has done. So that's that. I'm gonna just go through to current pregnancy. So in here, obviously, we talk about the LMP date in EDD, just to say that there's a lot of logic again. So if you put in the LMP, it will work out the EDD for you, as well as your BMI. So when you look at assessment, you'll see the BMI also populates as part of that. So all that's in there. If she was a late booker, you do get that question. So you can say what the reason is. You can set, because I know some trusts now are doing it from 10 weeks rather than 12 plus 6. So you can set for your configuration what your KPI is, whether it's 10 weeks or it is 12 plus 6. Was it? Yeah. So you can set that yourself in your background. And again, if she was booked more than that, then it would automatically populate with this as a mandatory field, and you have to put the reason why. Obstetric history, this is where you enter all of the previous babies. One thing I'll say about that, this is all in the video, so I'm not going to go into it, but one thing I will say about that is, one, that if she's booked, for example, she had a baby elsewhere, she had a baby in Bristol, and she's come to you for her second baby. Because Bristol is also part of BadgerNet, some of that information from her last pregnancy can pre-populate. So if Bristol's done all of the obstetric history at her last pregnancy, you can import that information into this new pregnancy. So again, it saves you time, and that's what you call the import obstetric history. And you just go into it, you select. I don't think I have any in here. No. You select the babies as well as anything else you want to bring across. You can bring across previous babies. You can bring across any social issues from the last episode, whether it's your last episode at your trust or another trust as well. So you can bring in quite a lot of bits from the last pregnancy into the new booking to save some time. Assessment is obviously where you do your OBS. Just the key thing about here is obviously we do about your CO levels, which is on every single assessment. So not just booking, every time she comes in to see you, and as part of our assessment notes that we do ask about the CO levels, and you have that there as well as part of that too. Health history, it's a huge note. I won't go into that because it's self-explanatory when you look at the video. The next bit is your routine inquiry. So your social issues and your routine inquiry bits. This is what triggers the yellow flag. So if you said yes to any of these, then that will trigger the flag. If I just scroll down, you've got FGM in here, but also you have your social issues as well. So you have a whole list of issues that you can tick from. If you've had previous children, you get more as well, and you can enter that information. As I said, this is what triggers your yellow flag. Screening. For the screening, you have your booking bloods and your first trimester. They do preset to your generic booking bloods. And here is just where you're sort of explaining and offering, and she accepts and declines, and then you can also record the taken. Depending on what you're doing with your bloods and your labs, it will depend on how the results come in. So I know it depends on where you go live and stuff like that, but that will come out in the woodwork in your interface discussions. But most trusts, for one, will have the fact that the results, when the results come in, they will sit here as like a view of your pathology system or your lab system. So you'll get these as a view of all the results. It's a results feed, basically. You get all the results here that you can show. And at the moment, most trusts now are inputting the results from the feed into here. We are looking at importing, hopefully by the time you go live, that'll be there. I can't guarantee that. But at the moment, most trusts are manually putting the results in from the feed that will be on the right-hand side. So they don't need to go into your lab system to look at the results. They can do it from Badger via the feed
It's
on the
ICE,
right-hand
by
side.
the way.
Oh, ICE, yeah, there you go. The same with your first trimester. So first trimester, if you click onto it, it presets with your downs and your edges and patés, and it works the same way as well, depending on how your results come. VTE, just to also key point about this, is the VTE assessment is a direct copy of RCOG. So you as a trust have to decide, are you a trust that does scoring? So do you, with your VTE score risk, is it a score? Is it a level? Is it intermediate? It is low and something or other high, I think. So there's two options to choose from in your configuration, based off of RCOG. So we don't make any changes to this. This is how it is. We don't have any localization on here apart from the fact that you choose that you are a scoring unit or a levels unit. There are configuration around your recommendations, so you don't have to follow RCOG's recommendations based off the score. You can add your own, and also you can add your own dose as well. So when you say if it's a particular medication, it will come up with RCOG, or you can put your own as well in there. So that's the only configuration we do. In terms of the risk, it's as it is. We don't make any changes to that because we're copying directly from RCOG. Pelvic health. If you do pelvic health, again, this is your pelvic health form, which has been worked with I think it's the National Pelvic Health Risk Assessment. So that's also there as well. There is a bit of configuration you can do around that too. And then risk assessment then. So based off of all the things that we've done so far, the medical history, social history, everything you've done, the system will work out what the risk factors are, and it will pre-populate once you click this button with the current risk factors. If you want to add any more, you can click into it and add more. There's a whole list of risks you can add from here. And then obviously you can also then assign what the overall obstetric risk is. It doesn't assign a risk. You, as clinical judgment, you will assign the risk. Also, people ask me about PBR. So in the background, PBR is worked out already for you. The midwife doesn't need to know what PBR payment it is. It's the reporting that needs to know that, and that's in the background. It's worked off by what's been inputted here at the risk assessment. So it's really important that the risk assessment is correct and updated correctly with the right risks. Based off
Can
the
I
risk,
just jump in and just share that PBR is payment by results? So if we don't put all the risks in at booking, then we don't get paid the higher premiums for those complex patients. So really, really important that if you're kind of going, oh, I don't know if she's normal or high or intermediate, always err on the side of she's more, she's more complex than you think. We can always step her down, but it's really difficult for the payment if we have to step her up. Sorry.
Okay. So yeah, and then for your recommended management plan, so based off of the risks that have been inputted, the management plan will appear here based off of your configuration. So there are lots of management plans in the back of the system where Gail can configure. There are absolutely loads. So for example, if you tick that she's a diabetic, then your Luton diabetic management plan would appear here as a recommendation. That's not the plan. It's just what you're recommended based off of your guidelines. What is the plan is the actual management plan. So here you can either just not follow that and do your own plan here and do that, which is fine, in a sense. Or you can import what's in here into here, and that's what this button is for. Import recommended plan. That means it's gonna take what's in here into this, and this will become the management plan for the woman. You can edit it, you can take away things and add things to make it individualized. And that's really up to you in terms of how you do that. The last risk assessment is your fetal growth and preeclampsia. So you're saving babies' lives and the other one, forgot. It's combined. So we don't, some trusts ask, how come we don't do it separately? No, we combine them because some of them do work together. So all your risk factors for those are here. Again, if the system knows certain things, it will tick yes for you. And then at the end, you do have, it will work out based off of the risk assessment here, if it's high or medium or low. You can configure this. So this, you can completely copy saving babies' lives, fetal growth, or you can copy NICE's option. There's two options, that or NICE, or you can add your own as well. There's some options that you can add your own as well. So there's lots of configuration around this, as well as configuring what each level, what each risk scoring would be, as well as the actions as well. So you can configure all this based off of your unit. And then I think everything else is pretty self-explanatory from the, that's the key point. It's from the video, so I won't go into anything else. I think everything else is really self-explanatory from the booking. One more thing about the booking, just to also say, is that at the end of the booking, then one, you can do referrals. There's lots of referrals in the system that you can do. I'll just quickly go into a referral note here. It's set by you, so you decide on what referrals you're going to use at your trust. Gail will configure those, and then when it comes to, for example, a smoking referral, they will be prompted to do the referral. They'll click onto find smoking, long list here, but they'll find a smoking referral. They complete the notes, which is in the video, and then it would appear as a PDF, and that PDF will be sent to the recipient. So whoever the smoking team is, Gail in the background will set up that referral goes to the smoking email address, and they will get that and action it accordingly. Once they finish the booking, then what also will pop up is the antenatal booking summary PDF, which I'll just quickly show you. It's not going to show me that way, so I'm going to do it this way. So at the end of the booking, you will also have this summary PDF to appear. So this will appear, and again, Gail can configure where that goes. So who needs to know about the booking? So it could be, this could go configured to go to the GEP. It could be configured to go to the health visitors. Whoever you would tell normally at the booking appointment, you can configure it to go there. And Gail, that's part of Gail's kind of config to do that. So that is all the key points from the video. If you haven't watched it, as I said, please go back and watch it. I'll open up for questions, and then we'll look at configuration. Whoever wants to stay for that, it's up to you. So any questions from that or the video that you've watched?
Stunned into silence. I have got a question for the community midwives on the call. So currently, how long does a booking take?
It takes about 2 hours.
Okay. I know you've gone live with Grow 2.0. Shireen, have you got Grow 2.0 on your desk system? Because we haven't mentioned that.
Yeah, I mentioned it later on, but it's fine. We mentioned it's here. But you do have the, oh no, because I haven't said this one was not set up for it, but I will be mentioning it next week for part of the Antenatal clinic.
Perfect.
But yeah, Grow 2.0 was within BadgerNet.
So when we create the booking, we don't have to do anything else to create the Grow charts?
No, because we need to, it will pre-populate. Yep, you can request a chart at the end. I think you have to wait until, what's there something? Can't remember what the triggers are.
Because isn't it within the booking, this is going off memory from when I used to use it, within the booking, when you're putting in your LMP, is it not round there that you have a question, does the patient consent to having a grow
No,
chart?
it's not there. It's the beginning of it's the demographics. So in the demographic detail of the booking, it does ask about consent. So all the grey fields are in there as part of the booking. So it is, I don't know, it's here. Yeah. So here you've got questions around if they have a existing grow ID. If they do, you can put that in. You can say grow discussed, and then the date you discussed it, and then consent. That's where your grey fields are within the booking.
Okay. So we won't have to write on paper anymore because all our assessments will be on here, and you won't have to go into Grow 2.0 and repeat what you've just done on BadgerNet. So hopefully we can shave a bit of time off your booking appointment. Might make life a little bit easier. Any other questions for Shireen or myself? So the link to the video is within the meeting invite. Please, if you think that there's other people within your departments, within your areas that would like to see a booking, it is 36 minutes long, this video, because obviously we are not speaking to a real life person when we're doing the booking. Please do ask people to look into it and then feedback any comments, questions, queries. I am currently setting up the test system and putting in all the information that we have into the test system, like setting up Teams, and I've just sent the emails to get the community list for Luton. So, and I will be coming around and being more present in the clinical areas with an iPad, hopefully, that I'm trying to get at the moment, just to show you what it looks like kind of live, so that you can have a little play and have some interaction. But if you want me to come and see you on a particular day or a particular clinic, because obviously I'm mainly based in the hospitals at the moment, then just let me know. Okay.
Okay, it's just the configuration then, whenever you're ready.
Yep. Yeah, I'm good to go.
Okay. In fact, do you want everybody to be on here for the configuration, or what do you want to do?
So I'll let people decide for themselves. Most people won't be able to access the config. This is something that the system admin and myself do. So if you want to go, please, thank you for joining. If you want to stay and just be nosy, you're more than welcome, because actually this is, for me, the meat of the system. This is where we decide and make those decisions of how things are going to look. And mandatory fields now. There will be lots of mandatory fields there to support our national reporting requirements and regional reporting requirements. So you may find that there's a few more than you see in CMIS at the moment, but they are there to support the data collection and support you to understand what you have to fill in. So yeah, down to individual choice, but carry on, Shireen.
Okay then, so as you know, Gail, the configurations in unit options. So I think the first thing to start thinking about is going to be really around your general tab. So I think you're part of the standard configuration. So a lot of this could have been done in your co-location already. So a lot of the things that are set by national guidance have already been done. So just have to double check that you're happy with them. Did you get the document to go with it? Did you get the standard config document to get with it, Gail?
I don't think I did.
Okay, well, I'll get that sent to you. Okay, so if we go things like, okay, so preeclampsia, let's start with that one because we did go on that one. So your preeclampsia settings, as I said, what do you follow now?
Hopefully, Jess, I'll see you're still here. What do you do for preeclampsia assessments?
Preeclampsia assessments at the moment, it's just on the aspirin and what is that? Hold on, let me look at the form.
Sorry to put you on the spot.
No, you're fine. So fetal growth risk assessment and also the aspirin form. So when we take a booking history and we ask them about previous history of preeclampsia or family history or current hypertension in pregnancy, we would just note it down, and then it goes over also onto the fetal growth risk assessment form as well as the aspirin risk assessment form.
What guidelines do you use for that?
Guidelines. Oh, it'd just be in the antenatal booking, no?
As in saving babies' lives, or is it NICE guidelines do you follow from? Is your guidelines following?
Jess, can I ask, is it in the Perinatal Institute notes or is it a separate piece of paper?
Separate piece of paper.
Okay. I'll be coming around collecting all the bits of paper at the end of January. So I'll figure it out then.
Yeah. So for most trusts, they either follow the NICE guidelines for saving babies for preeclampsia and risk and FGR, fetal growth rather, or they follow the saving babies' lives, or they do any of these with an additionals, and that's probably what you've done. You probably have followed one of these with additionals. So your probably thing to do, Gail, is to choose whatever one it is when you find out, and then what you can do is you can if you need to amend some bits so you're not doing certain things. So for example, on your particular one, you don't have, I don't know, type 1 to 2 diabetes, you can hide that. So you can choose to hide any of these that are part of the 2 guidelines, or your other option is you can add additional. So these are the things that some trusts wanted to add to the preeclampsia and fetal growth. So again, you can choose to hide or to add any additional from this list. If it's not on the list,
I think ours are based on saving babies' lives, but I also think Luton have made it Lutonized.
Okay, so yeah, you might need to use this to make it Lutonized then. So it depends on what it's on there. So yeah, have a look and compare it, and then you can configure that. As part of that, when I talked about the actions and things, so based off of RCOG, if I say no to this one actually, so you can either follow the NICE actions that's stipulated, or you can do your own actions if it's different. The same with the fetal growth one, you can just put your own in or copy whatever you use. So you can copy whatever your guideline says here. All right. That is how to configure your fetal growth. The other one is your VTE. So as I said, you have to decide whether you are scoring or not scoring. Do you know? At the end of your VTE, is it a score or is it a level? Anybody know?
It's a score.
It's a score. So you're a scoring unit, this is set 2, which is great. You can also say whether, in terms of calculating the dose, then you can say whether you want to use the booking weight or the current weight, because again, some people do. So you depend on your guidelines, you can choose whether you're using your booking weight or you can use the current weight, and that's what that configuration is around as well. So these are 2 bits for you, main bits for you. There are bits around the medication. So again, where it said tinzaparin, delaparin, and I can't remember what the other one was, you can show or hide that if you want to, depending on what you're doing. And also at the end of the VTE, there's an action section. You can choose to display that or hide that, depending on what your current paper VTE is doing. And then you can also configure your weights. You can configure definitions. So some trusts wanted to give a little bit of definition around some of the risks there, again, depending on their actual guidance. So you can actually put in there what the definition of is for each risk, and that will display within the right hand side panel of the VTE note as well, just to give the clinician some guidance. All right, so they're your 2, I'd say, in terms of config this week. To get that in place, I would say concentrate on these 2. They're the main 2 to get on with. Your other one to sort of concentrate on is your general settings. In here is where really you want to look at, I mean, this is huge. The general settings doesn't just cover booking, it covers all aspects. So in terms of booking, things like here is your location of sampling. So when you are taking the blood, So in that blood test form, when we looked at the booking bloods in the first trimester, there is a field in there called location of sampling. It's a configurable form, a field, so you can select what those are for your trust. So obviously, Bedford would have their own list, and Luton would have their own list of where potentially blood can be taken. And you can have that as a list there as well. I think. You don't do continuity pathways, do you? Do you?
No, we don't.
No. So
isn't there a teenage pregnancy or a vulnerable liberty team in Luton? Is that classed as
It's not classed as continuity, no.
No, yeah, they're not, no.
Okay.
Perfect, thanks.
So we can't hide that field, just put none in there, so then that can be selected as none. I didn't talk about appointments, actually. We'll come back to that. And then I think the other bit for booking would be, I think that's mainly for booking. So a lot of this, Gail, we'll come back to anyway, even after the demonstration meetings, we will come back to that. So again, your first trimester screening, most trusts will do, which is already defaulted, to the Downs and Edwards and Pateaus, but some trusts are still, I don't know how, but are still just doing Down syndrome for first trimester. So that's the case. You can select that as well. And they're the main ones I'd say you concentrate on in terms of booking as well as part of that. Because of your standard config, all of your assessments would have been set by that, so that's fine. I'm going to come off of this. And I'm going to go to your reports admin. So where I showed you at the end of the booking, you've got the antenatal booking summary, and you want to think about where that will go and who needs to know about the booking. There's a couple of things to say. So when they click on, when the end of the booking and they've clicked onto the antenatal booking summary, they can be stopped from sending if they haven't done something, because as much as we've got lots of mandatory fields that you can turn on and off within the form, there are some things we can't make them do. So we can't make them click onto a button to open up another form. So this is where you can capture that. So if they haven't, I don't know, done, for example, they haven't gone into, I don't know, let's say they haven't gone and done the first trimester screening, they haven't clicked on that button to do the first trimester screening, when they come, and if you've clicked here in your DQ check, what will happen is when they come to print, it will say you can't print because you haven't done your first trimester screening, and it will give you a link to it and they will do it. So it's another way to capture data quality. So this is what we call report DQ checks. So you can select certain things from here to make them compulsory before sending the summary report. So it works quite well, actually, to ensure good data. Once they're able to send, then they'll be able to send it to wherever you want. So this is where you configure where that report will go. So I kind of guess that the report will definitely go to your GPs, won't they? And hopefully you do have an EDT system. You do have a system where you've got your document management system, Gail. Do you have that basically where it sits on the server and it goes to GPs?
I'm trying to figure that out right now.
Okay, so hopefully you do. There's a few just that don't actually. I was quite surprised, but what this does, when the user clicks onto save of the form, that PDF will sit on the server, and your IT would have done some wonderful things in the background, and it will go to that woman's direct to GP and sit on their system. So that's what that does. So making sure that you've got antenatal booking in this list so that it will sit on the server and be distributed to the correct GP. You can also here send it to certain email addresses. So you can also configure not going via the server, it can go via actual email address. So if you, for some trusts, they might send the booking to Child Health, then you can put in the Child Health email address again, and when they click on to save, it will also go there. So it's just to think about that process of what do you do now? Who knows about the booking now? And then mimicking that within BadgerNet, and they can use that. Okay, so that's your reports. Also, emails. So when it comes to the emails, not email, sorry, referrals. There are lots of referrals that can be sent. So I talked about smoking, it could be healthy weight. There's absolutely loads of referrals. So again, looking at your as is process now and thinking of the referrals that potentially would be sent at booking process and then mimicking them in BadgerNet. So we have a whole list of referrals that you can set up. They will all have the recipient, so you can put in the recipient email address in there as well. And also you can do your own. So if they're not on this list, if you have a particular one that we don't have set on BadgerNet, you can customize your own referral and call it whatever you like. So not only you have your own set referrals by us, but also we have referrals that are set that you can set for yourself as well. So just to think about again with your as is, what referrals you would send at booking at this point and doing the same in the system. So that's where our set ones are. In terms of your custom referrals, it's on the top bit here with the referral tab, and here is your custom referrals. So these are the custom referrals that we've done. If I was to do a new one, just press the button. It's here. You can just create it yourself. So you can say what the referrals can be called and then what the recipients are. The referral. You can also in the referral have referral reasons. So when the user says why they're referring, that you can put in here the reasons for that referral in here, and it will be a drop-down list for the clinician. And then also when it says about blocks to include in the PDF, you're talking about what information will be in that PDF to include as part of that referral. So essentially, as I said, you can if you've got a particular referral that's not on our sort of generic list, you can create your own via custom referrals as well. I'll also show you your wards and teams. So when we talked about being assigned to team, community midwives being assigned to teams. So this is where Gail will be inputting all the team names in and then putting them in groups. So you can put them all in one group, if it depends on how many you've got. Put all the midwives in one group, or you could put them in a group where they're buddies. So maybe, me and Gail work as a buddy. I do part-time, Gail does part-time, that kind of thing. You put them in one group. So that works out quite nice in terms of your continuity care figures and things like that. So that's where Gail you'll be inputting your team information and the midwives. Now in test, because you're not going to have all of your users in there, just do some generic stuff just to kind of for testing. But when you have access to live and when you have your user import just before you go live, then you'll set that up in your live system with all your users just before you go live. But this is just for testing really at the moment. So that's where your teams are as part of that. And my last thing to say actually is to go back to here. I think I've got it on mine actually. Yeah, yes, here. So as I said before, when the referral or the record has been created in your PAD system, in your patient, what is it again? Is it Sona? No, it's not Sona, is it, Gail? What's it called? IPM. IPM, I remember now. Yeah, so when the file is made on IPM and BadgerNet, and it tells BadgerNet to create a record, it will bring across the demographic details into that record. So when the midwife opens up that booking form and goes into certain forms, you'll see, the NHS numbers already pre-populated, the hospital numbers, the date of birth, the address, the full name, surname. Sometimes next of kin normally comes across most trusts, as well as ethnic category also can come across, and telephone numbers also can come across. It depends on what you want to bring across. So you can bring those across. And normally what we say is if they're coming across from IPM, they should be grayed out. So you should be able to edit them on BadgerNet, because IPM is your master. And if changes are made in BadgerNet and not made in IPM, it can cause issues. So any changes that are needed to do with any of those fields need to be done at IPM first. And when it's been done in IPM will update BadgerNet. So what this is about is deciding what fields will be grayed out. So what fields are coming from IPM, and then you would grey them out so that the user can't enter them. But that will come later on, Gail, in your interface discussions when you look at what is actually going to come across from IPM. And then once you know, then you can come in here and grade them and select them and grade them out to selectively grade out. So they can't, it's only read only, they can't edit those fields. Is that right? Does that make sense? Cool.
Yep.
So yeah, that is, I would say, because it's quite a lot, that's your main places to go. You could start, one thing you could think about as well is your alerts as well. So as I said, at the bottom of the banner of the pregnancy summary page, we looked at when you first log onto a record, you have your alerts. They're triggered by certain things. So again, we have a whole list of alerts within the system, absolutely loads that you can turn on. I wouldn't turn on loads because then you don't see the important stuff, if you know what I mean. So really think about what your alerts should be at the bottom and then turn them on for each trust as well. One thing I forgot to mention actually while people are on the call is, let's go back to my record, 2 things actually I forgot to mention, which is in the video anyway, but was about your appointments. So at the end of the booking, you would have made an appointment for her 16-week and probably an appointment for her scan and her maybe consultant appointment. So again, hopefully with IPM, appointments that are made in IPM will continue to be made in IPM, hopefully, and that will again be confirmed with your meetings. Gail, you unmute yourself, so you might already know what's going to happen with IPM appointments. Go on, you talk.
Community don't put appointments in IPM as far as I'm aware, so probably
manual then.
Looking at maybe doing something in appointment books to take away from diaries, but Jess got her hand up.
Yep.
We do use IPM in community.
Yeah, community do use IPM. They're just setting up booking clinics now, but they do schedule appointments in IPM.
Okay. So part of the interface, what normally happens is any appointment made in IPM will cause an appointment note in BadgerNet automatically. So because as much as you make it in IPM, it won't be seen in BadgerNet. If you don't have that interface as such, you wouldn't see it in BadgerNet. The woman wouldn't see it in her app either. So the beauty of the interface, the messaging that we're going to do for you, would bring across any appointments that have been made in IPM and coming across to BadgerNet. So basically, if I show you what the appointment note looks like, this would be pre-populated from what IPM has put it in. Okay. So then once that's been pre-populated and saved, then you'll see it on the front end, but also the woman in her app will also see it. There might have to be some sort of configuration, because remember, if the woman's seeing it, it's come from IPM. It depends on what that looks like, because it could be very, I've had trusts where the information put in IPM is very, it's not hard for a woman, it's quite hard for a woman to read because it doesn't make much sense. So it's just making sure that if it does, that's great. If it doesn't, then we just look at how that displays for the woman. But that, again, that'll be part of your configuration and stuff like that. Now, Gail just mentioned we do have appointment book, which again, Gail might have to think about, but appointment book is a scheduler within BadgerNet, which there is a whole video on it in the on your board, Gail, so you can send that out to people so they can watch what the appointment book is about and how it can be used. Most trusts are now using it for community, so something to think about. It might be a change of process, it might not, depends on what you like about it. So I'll leave that for Gail to send that to you, everybody, to have a look at that, and then we can have a discussion from that. So yeah, appointments would come, at the moment, we're saying it will come from IPM and then populate BadgerNet for you. There was something else and I forgot. Something else, or what was it? Appointments. Things to do. So at the end of the booking appointment, what is quite nice is we have reminders. So as much as we're trying to capture, data quality is great. We are capturing it via your mandatory fields. It's great. We're capturing it via when you're trying to print something or send something, we're saying you can't send it because you haven't done something with the DQ checks. Another way to help with data quality is things to do, reminders. So reminding the midwife to do something that she may have forgot through the pregnancy or through the booking or whatever. So on the right-hand side of each tab will be a things to do. Well, there's a whole section on reminders, okay? This has loads because this is a delivered woman, it's got to bear in mind. But mostly at the end of the booking, there will be things in here that they may have forgotten. You can turn these on and off. So you can turn on the reminders yourself or turn them off. Each reminder, so for example, I forgot to do the FGM questions. If I click onto it, it will take me straight to the form to do it. And once I complete it, it will get rid of it. All right, so it's a good way to capture data quality. So if you've forgotten to do something and it's been selected as a reminder, then it will be there. And you can see what's quite nice is for your bloods. So if you haven't offered booking bloods, it will come up on here to offer the booking bloods, or we haven't offered the Down syndrome, it will come up here to do that. If you've offered but she hasn't accepted or declined, there'll be a reminder for that. If you've offered, accepted, or declined, but you haven't taken, it will give you a reminder for that. And if you haven't put the results in, it will give you a reminder for that. So there's lots of reminders in here for the clinician to do, as well as part of data quality. Also, as part of that, we do have your MSDS reminders too. So even if anytime we've forgotten something, it's also there as part of MSDS. And the last thing to say about reminders is that as much as we have a list of reminders that you can be set, you can do your custom reminder. So for example, if I just click on the add task, I think it's called, it's not there actually, it's something we're doing. So if I just put it here, you can create your own reminder. So if I on here in the task button, I can click on to add task, and maybe at the end of my booking, I'm not going to be there at the next visit, and I want to remind the next midwife to give her MAP B1 or something, I don't know, whatever it is. You can press save, and then that will then sit on the reminders. There's custom things to do, so you can create your own as well reminders. This works nice in the community, but also works quite nice on the wards as well, as a list of things to do for a woman once you've handed over, so you can use them in different ways as well. So yeah, that is that, I think, for today. Done configuration, we've done those bits. I said, if you haven't watched the video, please watch the video, because it goes into a lot more detail than I have today, because as I said, the whole prerequisite to this was to watch the video. So if you haven't, please go back and watch it. Gail will also send you, I'm sure, the appointment book one, just to kind of have a look at that, to start thinking about, do you want to stick with IPM, or do you want to look at down the appointment book route? So have a look at that as well. I'll be with you next week again to go through antenatal care in the community, as well as outpatients, and I'll be demonstrating that, so it'll be a whole demonstration and questions and things. So if there's no more questions, we're good. Kellyanne?
Sorry, I have a question. An apology if you've already answered this. I joined a little bit late. If we book in BadgerNet, will that feed back into IPM if required?
No, there's no interface between BadgerNet and IPM. The other way around, IPM feeds into BadgerNet, demographics, appointments, admissions, transfers and discharges, and the baby registration, but there's no feeding back as such from IPM, from Badger.
That's fine, thank you. I just wanted to check, because it may affect our downstream systems, which may impact our decision.
That's okay.
Thank you.
Any other questions?
I mean, that's an important point to know that Kellyanne has raised. So currently our ADTs are done within our current electronic system. Okay. So just for awareness that, you know, any ADTs won't be done in BadgerNet. They will need to be done in IPM, and IPM will feed BadgerNet that information to say that admission or that transfer. Now, we'll come on to it, but there is an SBAR form within BadgerNet that we can use as well. So if, say, a patient's moving from one community team to another, thinking we've got lots of community staff on this call, if you wanted to, you could complete an SBAR so that the other person, you know, that you're handing this patient over to, you've had that kind of discussion and documented discussion that you've handed the patient over. Any other questions before we bring the meeting to a close? Does anybody need anything from me? I shall take silence as a good thing. Ola.
Yes, please. Thank you very much. Yeah, just from conversation with the users at the moment, especially from the safeguarding bit, they've asked some questions around, like, if an update has been made on the system that has to do with them, is there any way of them getting an alert or notification without, that prompts them to go look at the information that's been inputted on the system, especially from the community team?
So sorry, is that within BadgerNet? So you've done something?
Yeah. So
Yeah.
good question, Ola. So Shireen, what she's so if we, as a community midwife, or so it's both ways. So as a community midwife, I've seen this patient. She's now disclosed something that she's never disclosed before. That's a safeguarding issue. So we update BadgerNet to say, actually, now we're worried about this patient from a safeguarding perspective. Is there an alert to then alert the safeguarding midwives that there's been an update, and vice versa? So if the safeguarding midwives update, is there a way to alert the community midwife?
There's no alert to individuals in BadgerNet. We don't do that. So one, in terms of the midwife app, you found out an issue, and that would be more of a referral, really. You could use BadgerNet to refer to the safeguarding team. That's what most trusts do. If they've done a booking, or whatever, they are known of an issue, then they would do a referral to the safeguarding team within BadgerNet, which would be set up, and it will go to the referral team. Or another thing could be is that if they've put in the risk assessment that they are safeguarding concerns, then there is a patient list, and this is all to do with safeguarding. So there is a safeguarding video all about that. So if you want to look at safeguarding more in detail, please look at the video. But there is that's not one. I think it's here. There is safeguarding social issues, I think it's called. So there is a social issues list. So if the midwife has selected, which does pre-populate, safeguarding issues, then they will sit on this list. But BadgerNet has no functionality to alert a particular midwife or a particular team. It has to be done manually via a referral or however
I
you do
will
it now.
say, when you're entering the social information into the form, there is a field that we can make mandatory, or used to have a field that says, have you spoken to the safeguarding team? Yes or no, and we can make that mandatory. It's kind of like a prompt. So if you have put that in, there's also, I think the question is yes, no, or not applicable. So if you've put no, we've got no concerns, and it's not applicable to let the safeguarding team know. But if you have identified something, then it does prompt you to say, have you told them? Now, it's going to be supported by Process This. So it will be talking to the safeguarding team and letting them know, actually, when they get some more information about a patient, then they need to just send an email out to all the people involved, so community midwife, obstetrician, to say, can you please have a look? There's been an update to this patient record.
Okay. Yeah. Because the issue is more around the chronology at the moment, which is, that they're emailing back and forth between each other. So they're thinking if it's something that can be built for them, especially the chronology bit on the system, that, once it's updated from the community, they can pick it up and do what they need to do from their end. But at the moment, it comes like in Luton, it's more of paper, and, copy, and then while in Luton, Bedford is more of emails between each other and sending the forms back and forth. So we've just been asked. So I think it's something.
Again, watch the video, because there is a whole section on safeguarding. Which gives you the chronology anyway. So anything that comes into any notes saved around safeguarding will be here. So this is your chronology. This list here. We don't know anybody in here. This will be everything. So as long as you know that there's something there, then all of everything to do with the woman in terms of safeguarding is here, and that's what users of trust use as the chronology. Is this list
and you
here.
can also save letters, you can save emails in the correspondence.
You can scan stuff in.